I'm Jessica Sedevie. I'm an OBGYN obstetrician gynecologist at Sanford Bismarck. My experience in this pandemic, I feel like starts even before my vaccination. So working as a healthcare provider during the pandemic, and I at the time had a 2-year-old little boy, and we were trying to give him a sibling and had to put treatments to help that on hold because of the pandemic, but also coming home every day not knowing if I was going to bring something home that was going to hurt him, and having my 2-year-old run to greet me at the door and dodging him so that I could, change out of all my clothes and decontamination showers and things so that you didn't bring anything home that was going to hurt your family, and just living with that daily. And then we did get pregnant, which was great, and then started getting more and more information about how pregnancy was a safety risk in terms of patient risk profiles. And so had some patients that I was unable to care for because they came in with COVID, and my amazing partners took care of them for me so that we could reduce my risk. When the vaccine came out, I initially was just reviewing information because I wanted to be able to talk to my annual patients. I didn't think that it was going to be an option for pregnant patients, but I wanted to be able to say something intelligent to my annual patients who are going to have questions. Because at first I was skeptical too. I'm like, man, how does something come out this fast that's safe and okay, and that I can endorse? And as I looked into it, the red tape sort of sessions were shortened. They started producing the vaccine while the trials were ongoing. I actually have friends who were in the initial vaccine trials. And so when you look at all of that information, there were more patients that were in the initial vaccine trials than for the Tdap or for the HPV vaccine, which I routinely recommend to patients. And so I felt like, this is something that I'm going to feel a lot differently about once I had done my research than before, based on how quickly it came out. And so then when ACOG said, hey, you guys need to make this available to pregnant patients, and I realized that I could potentially be on that list, it was literally within days of when the vaccine came out for us. I had talked to my healthcare provider and to maternal fetal medicine to make sure that I wasn't jumping to make a decision. And we all felt like it was the best thing for me and for the community, my patients, my family. And so I received it the first week that it was available. So felt a lot better finishing out my pregnancy after having a couple of vaccines. And then knowing that some of that immunity was going to cross to my daughter, Charlie. She's done well. She's 7 months now. And I was diagnosed with COVID 2 weeks ago, came back to work, and did okay for a while. My entire family has tested negative on a couple of occasions now, so it seems like probably this is where I picked it up, which is not surprising. It made me feel better knowing that my husband was protected and that my daughter had those antibodies, and that she was able to continue getting antibodies through breast milk. My family is well, and my kids were able to go back to daycare today, and I'm back working. So when I received my vaccine, I did not experience a lot of side effects. I felt a little fatigued and my arm was sore, but I was also a practicing obstetrician in my 3rd trimester, so there were some days where I couldn't have told you if I was fatigued from life or from the vaccine, so it really wasn't much of anything. I've had some patients or friends ask me if I feel differently about receiving my vaccine since I had a breakthrough case of COVID. And I would say definitely I would get the vaccine again. What we're seeing is that as a whole, patients who have been immunized in the past have fewer symptoms and less severe disease. And so while I did get COVID, as far as we know, all of my contacts have remained negative, so I haven't spread it to anybody, which I think is a positive. I think we're seeing some information that maybe you spread for fewer days than you do if you're unimmunized. Also, the disease severity is less. And so while I was unable to snuggle my babies as much as I wanted to, and I was unable to work and missed some big important moments for some patients while I was out, I was never admitted. I was never short of breath. I didn't have fever or chills. Honestly, if I wouldn't have realized that I couldn't smell basil while I was cooking dinner, I wouldn't have realized that I had anything different from a cold initially. And not to say that COVID's no big deal, because we know that for some patients it is, right? And so I just feel fortunate that I wasn't exposed to the virus before I was able to have this extra protection. Regardless of my breakthrough case, I feel that anybody who can get immunized should be immunized against COVID.